everyone, I'm Dr. Vasuki and I'll be making a few anatomy videos just to make anatomy a little more easier for you. Today we're going to talk about a very important bone, and that is the clavicle. So why is the clavicle important? The clavicle is a horizontal long bone which is slightly S-shaped, and it is present in the junction between the root of the neck and the rest of the trunk. It is the only bone that attaches the upper limb to the axial skeleton. Now, what are the functions of the clavicle? The clavicle is very important because it acts like a strut between the center and the upper limb. So, what do I mean by a strut? It basically keeps the upper limb further away from the midline so that your upper limb can move freely. Imagine I did not have a clavicle. What would happen? Your upper limb would collapse towards the center and the movement might not be free. So that is the first and foremost function of the clavicle. It acts as a strut and it keeps the upper limb away from the midline so that it can move freely. The second most important function is that it acts as a force transmitter from the upper limb to the axial skeleton. So when you try and lift up something heavy, the force of that object can easily hurt or injure your upper limb muscles and your upper limb bones. So the clavicle transmits some of that force towards the center and it reduces the force and pressure on your upper limb. Third important point is that it forms part of the shoulder and it helps the shoulder girdle in movement and also acts as a bone for attachment of important muscles like the trapezius from the back, the deltoid, the subclavius muscle, and many more. It forms two joints of importance. On the center, it forms a joint with the sternum and the costal cartilage of the first rib, and this joint is called as the sternoclavicular joint. This joint is the joint that holds the clavicle towards the center. On the lateral end, it forms a joint with the acromial process of the scapula. This is again very important joint because it holds the scapula to the clavicle and hence holds the scapula stable while the shoulder joint is moving. Now let us look at the different parts of the clavicle. The clavicle has two ends, the lateral end as well as the medial end, and a shaft that connects the two. The lateral end is flat above downwards and the medial end is quadrangular in shape. Now the shaft that connects the two is S-shaped with a convexity and a concavity. The convexity is on the medial 2/3 whereas the concavity is on the lateral 1/3. At the inferior side of the clavicle, you can appreciate a longitudinal groove in its medial 2/3, which is also called as the subclavian groove, where the subclavius muscle attaches to. The lateral end articulates with the medial margin of the acromial process and the medial end articulates with the clavicular notch of the manubrium. Now, talking about the side determination of the clavicle. The clavicle side determination is made by the fact that the lateral end is flat above downwards, the medial end is quadrangular in shape. So you place the quadrangular side towards the medial end or the medial side of the body, and the flat side, that is the lateral end, towards the lateral side of the body. The second determining factor would be the concavity and the convexity of the shaft. So the convexity is usually on the medial 2/3 or the medial side of the clavicle, and the concavity is on the lateral side of the clavicle. So that is the second point which will allow you to determine the side that clavicle belongs to. Another important point is the fact that the inferior side has a longitudinal groove. So the side with the longitudinal groove will be placed inferiorly. Let us talk about the attachments of the clavicle. The lateral end provides attachment to the fibrous capsule of the acromioclavicular joint, and the medial end provides attachment to the fibrous capsule, the articular disc, and the interclavicular ligament of the sternoclavicular joint. In the lateral one-third, the anterior border is concave and it provides attachment to the deltoid muscle, and the posterior border is convex and it provides attachment to the trapezius muscle. In the medial two-third, the anterior surface is convex forward and gives attachment to the clavicular head of the pectoralis major. The posterior surface is concave backwards and gives origin to the sternohyoid muscle near its medial end. The lateral part of this surface forms the anterior border of the cervicoaxillary canal and is related to the following structures: the trunk of the brachial plexus and the third part of the subclavian artery. The superior surface, the clavicular head of the sternocleidomastoid, originates from the medial half of this surface. The inferior surface presents the following features. The costoclavicular ligament is attached to an oval impression at its medial end. The subclavius muscle is attached to a longitudinal groove present on the surface. The clavipectoral fascia is attached to the margin of the subclavian groove, and the nutrient foramen of the clavicle is located on the lateral end of the subclavian groove. Let us look at some of the peculiarities of the clavicle. It is the only long bone which lies horizontally. It has no medullary cavity. It is subcutaneous throughout its extent, which means that it is below the skin throughout its extent and can be palpated throughout its extent. It is the first bone to start ossifying between the 5th and 6th week of intrauterine life, and the last bone to complete its ossification at the 25th year of life. It is the only bone which ossifies by two primary centers. It is the only long bone which ossifies in membrane except for at its medial end. It may be pierced through and through by a cutaneous nerve, that is the intermediate supraclavicular nerve. Now let us look at some of the clinical correlations of the clavicle. The clavicle is the most commonly fractured bone in the body, and the fracture commonly occurs between the lateral one-third and the medial two-third. So the junction between the lateral one-third and the medial two-third. It is usually because this is the weakest site, and this is where the two curvatures of the clavicle is going to meet, and the transmission of forces from the clavicle to the scapula occurs at this site through the coracoclavicular ligament. And the fracture usually occurs due to a strong impact on the hand or the shoulder when the person falls on the outstretched hand or the shoulder.